All right, good afternoon. My name is John Hage. I'm the chair of the Finance Committee for today, even because Mr. Tanner is not here. I guess I might be chair all the time now, am I? Yeah. Okay, I'll be chair all the time. I'd like to state for the record that this meeting has been duly noticed. Today is Wednesday, January 21st, 2026. I'm calling the meeting to order here today at 3:15 p.m. Ms. Lopez, would you please confirm by roll call that it will?
Commissioner Stamper? Here. Commissioner Ager?
Here.
Commissioner Nicole? Here. Commissioner Berry? Absent for the record. Commissioner Portapano?
Here.
Vice Chair Hage?
Here.
Chair Tanner? Absent for the record.
Is there anyone who wishes to address the committee? If so, please come up to the podium and identify yourself for the record. Each person will get 3 minutes to speak. This will be the only opportunity for public comments at this meeting. All right. Approval of the Finance Committee meetings minutes on November 19th. I understand that these minutes have been reviewed because, yes, I reviewed them as Board Secretary. Without objection, the minutes are approved unanimously. All right, Mr. David Clark, how are you, sir?
Great.
Good. Good to have you up here.
The district, as part of the strategic plan, has proposed to expand its footprint in Broward County. Therefore, I would like to request the Board of Commissioners of the North Broward Hospital District to authorize the district to execute a purchase and sale agreement for real property in central Broward County.
All right, I hear a motion to approve the purchase of real property in central Broward County as presented.
So moved.
Do I hear a second?
Second.
Motion has been moved and seconded. Are there any discussions on the motion? All right, if not, all those in favor of the motion, please say aye.
Aye.
Aye. Any opposed? All right, the motion carries unanimously. Thank you, Doctor. I'll give you a doctorate now. No doctors are not good. All right, at this time, Ms. Burt, thank you for coming up and giving us a presentation.
Awesome, thank you so much. Good afternoon, Chair of the Finance Committee for the day.
Temporarily.
And all of our commissioners. I'm pleased to share with you the financial results for both November and December this afternoon. So I want to start with November, and I want to share with you that the results against prior year and budget. So we closed the month of November at a loss of $3.3 million on a budget of $22.9 million, which is a $19.7 million better than expectations. And year to date, the system is at a loss of $23.3 million, which is also $75.7 million above expectations. And so if you look at our key operating volume indicators, you can see that we have an overall modest increase in total hospitalization. While if you compare us to prior year, we do see that our non-partitis with Florida Blue is impacting some of our volume metrics. So that's why you see declines in areas such as outpatient surgeries, physician visits, and admissions. So I do want to share with you that all of our hospitals and the ambulatory division achieved their individual budgets. And the other thing that I wanted to remind you of is that November 2025, so this is our 1-year anniversary live with our Epic system. And so some of our volume indicators and our metrics are attributed in the prior year to that. Looking at our net operating revenue, we're up 16.8% compared to the prior year, and 2.9% is below our expectations, and that's primarily driven by a stronger rate, which is being driven by our managed care strategy, a favorable payer mix, and that our commercial payer mix continues to exceed the prior year, even with the Florida Blue contractual status, and we can see our acuity has increased. And then when you're looking at total operating expenses, you can see that we're running below the prior year at 4.5%. That is in part because last year we had some very significant expenses in the month of November that was attributed to our conversion to Epic. And you can see that we're running 14.3% below budget. This is the labor picture year-to-date as it relates to November. And it's specifically around the use of contract labor and or agency. So I think what I really want to share with you here is labor continues to be a major focus for the organization. You can see that year-to-date we're exceeding our budgeted expectations by almost $9.7 million. And you can tell that when you look across the system, you can see that we're achieving that both through rate as well as through utilization. And then I'm going to just flip over to December really quickly. A similar story here. We finished the month of December at a loss of $5.4 million against a budget of $22.6, which is a $17.4 million budget. And you can see that as compared to the prior year, we actually have a $12.3 million improvement compared to results in the prior year. Again, looking at volumes here, you have total hospitalizations up 3.7%. ER visits are 0.5% over the prior year. Inpatient surgeries up 2.4%. Outpatient surgeries 12.1% down. That is partially being driven by our non-car status with Florida Blue. And then we also see physician visits being impacted by that as well as primary care. And again, when you look at our net operating revenue, we continue to show strength as compared to the prior year, 15.1% up, 5.1% up compared to expectation. And again, the same drivers, stronger rate driven by our managed care strategy, favorable payer mix, a greater commercial payer mix, and higher acuity. So the patient population that we're taking care of is a more acute patient. And then taking a look at total operating expenses, you can see that here we're above the prior year by 4.7%, but we still fall well below budgeted expectations by 6.4%. And so I'm also happy to share with you that year-to-date through December, which is the halfway mark in our fiscal year, that all 4 hospitals and our ambulatory division are achieving their individual budgets. And then here's the agency picture year-to-date through December. We continue to be focused in this area, 9.7 through November. Through the month of December, we came in 11.3 million better than expectations. So this will always be kind of a major focus from us because it's where a lot of our premium dollars go. And then here, this is where I start combining things a little bit and talking to you more on a year-to-date basis. So these are the trends for volumes. You can see at the top is total hospitalizations. And when you look, you can see that our admissions are 36%, our observations are 64%. And if you look year over year, we're actually up 3.7 above the prior year for the month of December. And then when you look at it from a year-to-date perspective, you'll note that we are 1.6 below the prior year, but that is also being impacted by our non-car status with Florida Blue. And then looking at surgical volumes, here you can see off to the right, you can see our year-to-date surgeries. We do have a year-over-year decline of 7.1%, which is roughly 878 cases. 856 of those 878 cases are outpatient surgical cases, and that is also partially being driven by Florida Blue, among a few other things. And then the other thing I wanted you to see is on the ER visits. So you can see that year-to-date we're running 3.5% below the prior year, but when you think about what those visits consist of, they're really the low acuity ER visits. And so what we see is we see more patients getting care in Broward Health Point, in primary care, in our physician offices, and avoiding those low acuity ER visits, which is actually a good thing for our community. And that also ties into our Better Together initiative, which I just want to make sure that I call out Chair Tanner. And then on the next slide, this is our community benefit slide. This is always my favorite slide to really talk about like what Broward Health brings back to the community. So the top part is about cost to care for that uninsured, underinsured patient population. So you can see that through December, which again is the halfway point of our fiscal year, we have provided $289.6 million in cost to care for that patient population. And if we look at every single revenue source from governmental, including tax revenues that we have to take to cover the cost of the care for that patient, you can see that we come up short by $63.1 million. that 63.1 million comes from us, from our day-to-day operations. And so that's really like our dividends that we pay back to the shareholders, which is the community of Broward County. You know, we continue to focus on this, and we will continue to report this to you every single month. And then I would be remiss if I did not mention that we continue to have a strong balance sheet as evidenced by our liquidity ratios. So I do want to call out, just to remind everybody, hopefully you saw the press release for Moody's, and we did also achieve an upgrade with Moody's most recently. And so we are currently at Standard & Poor's with an A+, Fitch with an A+, and Moody's with an A3 positive. And if you look at our liquidity ratios, you can see that we've set our goal one level above where we currently are. And our days cash on hand remains favorable at 286.3 compared to a benchmark of 246.7. Our debt to service coverage ratio, which measures our ability to cover debt with either our income or cash flow, is favorable compared to the AA- rating at 16.3 as compared to 5.6. And then our debt to capitalization ratio is also favorable to the AA- rated benchmark of 23.3, and we came in at 17.2. And last but not least, I just wanted to share with you the continued improvement in the organization's ability to generate and collect cash. This particular slide is based on the calendar year. You can see we have here 2021 through 2025, full calendar years. So I think this is a really an amazing slide. In 2021, we collected 81.7 million. In 22, 87.9. In 2023, 97.5. In 2024, 102.3. And I'm really excited to share with you that in 2025, we collected $120.9 million, which is an 18% year-over-year improvement. And that money supports the board's commitment to continued reinvestment into our assets and the infrastructure and the technology and the access points in our service line growth. And that is my report for November and December. And I'm happy to answer any questions.
Yeah, one question. Back to community benefit. Charity care, you know, all the numbers are great, but charity care actual to budget is astronomical. How?
Well, so charity care, just not to get too technical here in the boardroom, but Epic, we are having some challenges with classifying our charity care, and so we're working on that. It doesn't mean we're not providing it, it's just in order for us to be able to classify it as charity care. Epic does it a little differently than we did it in the past, but we believe that we'll have that caught up and reported properly before the end of this fiscal year.
Any other questions? Thank you, Mr. Burke. It's you again.
Thank you.
No motion for the.
I think you have to ask for approval for the interim financial.
Okay, all right, I do. Do I hear a motion to approve the interim financial statements for the months of November and December 2025 as presented?
So moved.
Moved?
I'll second.
Moved and seconded. All those in favor say aye.
Aye.
Any opposed? Motion carries unanimously without opposition. Item, still you.
Okay, it's me again.
Item 6.4, approval to enter into a contractual agreement with Intuitive Surgical for a place system, price per case, Da Vinci DV5 robot. Ms.
Thank
Burke.
you, Chair Pembroke. So I would like to present and request approval from the board to enter into a contractual agreement with Intuitive Surgical Incorporated for a place system, which is a price per case for the Da Vinci D5 robot and an estimated cost based on projected volumes of $4.336 million over a 7-year period. So this particular robot is advanced technology. It provides tactile feedback to the surgeon. It's technology used in urology, colorectal, complex gynecological cases, as well as multi-quadrant instrument-intensive surgeries. This will actually be replacing our oldest robot, which is roughly 9.3 years old now. And so I would be requesting that the Board of Commissioners authorize the district to enter into contractual agreement with Intuitive Surgical Incorporated for one place Da Vinci D5 robotic system at an estimated cost which is based on projected volume at $4.336 million over a 7-year period.
Thank you. Do I hear a motion?
So moved.
Okay.
Second.
Moved and seconded. Does a robot have a name?
It's
I'm sorry?
DB5.
A DB5.
Oh, but not like the human name.
No.
All right, moved and seconded. All those in favor say aye.
Aye.
Any opposed? None opposed. Passes unanimously, DB5. Consent agenda. Mr. Whaley.
Thank you, Chair Tanner. As we discussed in your individual briefings, there is one agreement that we're bringing to the board for your approval this month. The agreement is for on-call and inpatient care services for neurosurgery at Broward Health North. The agreement has been placed on the consent agenda, and unless there are any questions, we recommend that the agreement for on-call coverage and inpatient services for neurosurgery be approved as presented.
Okay. Do I hear a motion to approve the consent agenda item 7.1 as presented?
So moved.
Second.
First and second. That's very close. Okay. All those in favor say aye.
Aye.
Any opposed? None opposed? Motion carries unanimously. Without objection, this meeting is adjourned at 3:31 p.m.